Hello, thank you for watching this week's CEO update for the Heart of America Medical Center. My name is Eric Christensen, CEO of the Heart of America Medical Center. This week, again, just bringing out to the community and to our staff a COVID update. Just wanted to let everybody know as of tomorrow, we will have no active cases of COVID anywhere in our facilities, which is really good. We've had quite a large outbreak in our state and community and in our facility here in the past over the month of November, and now we're seeing a big decrease in COVID. So just really good news for the whole community and for the care center and for the acute care and all the facilities that we operate here. Also want to let everyone know the C wing on long-term care is currently closed. We do not have any residents with COVID, so the C wing is closed at this point. The COVID wing on acute, we have reduced it down to just a 2-bed unit at this point, as the need is no longer there for a 10-bed unit. However, we can certainly up that to a 10-bed unit within a number of hours if we need to. So the availability is still there, but we are decreasing it at this time, and then we can utilize those beds for other uses as needed. Wanted to update the staff in particular regarding COVID vaccine. We're going to get our COVID vaccines on site tomorrow. I did verify that through pharmacy. We'll be getting the Moderna vaccine here. They send the Moderna vaccine out to the rural areas because it's easier to store than the Pfizer vaccine. So we're getting the Moderna vaccine. The plan is, and where we're at is we're going to be offering the vaccine in the Fox from noon till 2:30 on Wednesday, and this is for frontline caregivers in the hospital side. So this is not for the care center, this is for the hospital side and clinic. Those staff who are frontline caregivers will be receiving the vaccine if they wish. If you do not wish to get the vaccine, you can certainly sign a declination form and get that into employee health. I myself plan on getting the vaccine, so I would encourage people to get the vaccine, and I think the research out there is very strong in support of the vaccine. So I would encourage people to get the vaccine, or if you have concerns, you can certainly speak to your pharmacist or nurse or provider to go over the concerns of that vaccine. Wanted to bring up to the community, and this is something we're going to be working on going forward, is the concept of an essential caregiver. Even with the vaccine and the COVID going through the community, we're still seeing significant restrictions on visitation. And the visitation restrictions that are put out by CMS, they're not even developed at the state level, they're developed at the federal level. However, in looking through the guidance from CMS and discussions with the state and various officials, it became apparent that we could develop an essential caregiver program, basically having family members or friends train in as volunteers and do one-on-one work with their family members. So we are looking at developing this program. This would allow visitations on a daily basis in the weekdays and work with either your parent or family member or friend on a one-on-one basis. So just letting everybody know that we are going to develop this program. If you have questions or be interested in such a program, Shelly Block at extension 2315, Becky Hershey at extension 2259, or you can call myself at extension 2218. You can call those extensions if you have any questions about the Essential Caregiver Program and the volunteer program that we would like to start up here to enhance just one-on-one time with family, with their residents in the care center. And if there is enough interest, we'll be scheduling probably a meeting to go over the program. If not, we can start up these programs just one at a time as people come in. But we'll certainly be hearing more about this as we move forward, and hopefully we can increase visitation engagement and time with our family members in the care center. And so this should be a really good program. I'm very excited about it. Just want to send some thank yous out to people in the community, particularly Riley Coonan. Put together a lot of work and was able to get some just care packages out to the staff here. Just a big thank you out to Riley and all the work that she did. It was greatly appreciated. It's amazing how much people just appreciate these messages of letting you know that you're thinking of the staff here and you know what the staff has been doing, and just really appreciate that. I just want to thank the community. There's been a lot of support out in the community. People just reaching out to the staff and thanking them for their work. And for all that they've been doing. So I just really appreciate the community and all that you've done. I thank the community for taking on the mask mandate and all of that. I think that's really helped in preventing the spread of COVID, and just for all that the community's been doing here in the last couple of months. Really appreciate it. And finally, the staff, I just want to thank you for being amazing. Some of the things that the staff have done here are just beyond words. Some of the stuff we're doing, they didn't sign up for. but they're doing it and they're going above and beyond. So just want to thank the staff and all the hard work that they do. They truly care for the community, for the residents, for the patients, and for their coworkers. They really make a difference, and they really are the epitome of what caregiving is and what it means to be a healthcare worker. With that, I just want to remind everybody, I know we're seeing a decrease in COVID, but I still want to remind everybody to continue to wear the mask. That will help, even with the vaccine and all this stuff coming out. Let's just be diligent. Let's see this out to the end so we can finally see the end of COVID and this infectious disease that's running through our state and nation. And then also follow the North Dakota Department of Health guidelines. They're coming out and you'll see them periodically. Just ask that you continue to follow those, either as people in the community or staff members and things like that. Let's continue to do our best to protect those around us. And so with that, thank you again for watching. And remember, at Heart of America, your health is our passion.